Diabetes is also an important issue in Aboriginal health. In what way would the textbook support the study of diabetes? And do you have any guidelines for instructors teaching diabetes in this context?
Mm. Well, although the detailed specifics provide the essential background to the subject, I have found that the students respond well to case study based teaching and the presence of guest speakers who have personal experience or family experience to relate to the students. I give a brief lecture initially and provide the historical context of Aboriginal diabetes in Canada. The students usually watch an audio, visual material on the subject matter, and they then take that material and answer questions based on the video that they have watched and on the speaker's presentation within the classroom setting, using both as case studies on which they would work together in groups, answering questions that I have provided. They examine diabetes and how it affects individuals and families, and how community-level mechanisms can be created to help improve diabetes rates. Again, this requires a class to be broken up into small groups to answer study questions, groups of 3 or 4 individuals. They consider the case study of Sandy Lake, for example, and Kanawaki in Quebec, and discuss their respective approaches to diabetes treatment and evaluate the programs that have been developed in these communities. And they are asked to come up with ways or suggestions to help ameliorate the difficulties surrounding diabetes in the communities. I asked them how long they think it should take or would take for many of these interventions or mechanisms to be implemented, or how these programs could be modified for integration into other communities. And then they discuss the need for more long-term intergenerational and continuing programs for treatment of diabetes in communities.